I will call forensic audits and investigations on some of these things, which Ghana has said it's going to do and has not done for several years now. That is just the fact. I don't know if it's a matter of political will, or I don't quite understand it. We've identified this problem. We've seen how big it is and how much revenue we are losing. Yeah, we are just not doing anything about it, apart from saying that we've realized that we are being cheated by this and this and this. We're not doing anything about it. Another thing, for example, this issue about ring fencing of extractive industry projects. Yeah. The way we started with the mining industry, we say we're extending it to oil and gas, the oil and gas industry. I would like to know, have we actually implemented this? Upstream oil and gas companies still carrying over losses from certain operations, are using it to offset revenues from other operations in order to avoid paying tax. These are all issues, very large volume issues we need to look at in terms of the amount of tax revenue that we lose when we don't apply the laws which are on issues which we have identified as ways in which big companies are evading very large amounts of tax, as separate now from the more retail side, like as Elon pointed out, property tax, which is the immense hole in our tax system. All right. The fact is that if we applied our tax administration the way it's supposed to be done, we'll be getting much more revenue. Think about it, paperless ports. Yeah. Look at how many years we've gone for going all that revenue. It just took one proper policy put in place and it changes the game. And I'm saying that if you look at the issue of tax exemptions and transfer pricing and ring fencing of extractive industry pricing, there are several areas of tax administration that will have similar effects. We're just not being bothered. We are taking the easy way out, increase VAT. I mean, that's the simplest way out. This government, when NDC did it, they said it was a lazy man's approach. And I agree. What's happening now? This new government is now taking the same lazy man's approach.
Quite interesting. I think government should continue with this digitization agenda in the major revenue areas, like what we saw at the ports, GRA, etc. I think the payroll, digitization of the payroll and cleaning of the payroll of ghost names should also feature prominently. And I'm happy the special prosecutor is teaming up with the Auditor General to enforce this. One other thing I think we can also do is to work very hard to block the loopholes in the major MDAs. A lot of leakages in those areas. So like Bawumia said before, coming into office, that the money is here. When we come, we will find the money to finance the projects. And he said that if we were to cut out corruption, block the loopholes, the leakages, we'll be able to save enough money to finance, a lot of the projects like the free SHS he talked about. I also, talking about free SHS, I want to state that I think we should review the free SHS policy. Let's just say it before it gets too late. Yes. If you say it now, you take the flags, in due time, people will get to understand what the issue is. For example, let's ensure that people who benefit from the free SHS are people who really need it. So let's introduce a mean testing or a mean tested approach for the free SHS and for all major social intervention programs. Somebody whose children have attended, private schools throughout doesn't really need the person's secondary school fees or senior high school fees to be paid for. So that, if you're able to do that, you may cut down the number to about a third, and that will help the government save a lot of money. If they can do this, block the loopholes in the MDAs, and then continue the digitization of the major revenue areas, I think government will have some more money to do the other things. Of course, and the other mundane matters of widening the tax net and introducing things we've talked about many times, like property taxes, etc. I think the government should be good to go.
Just to add quickly to what Selvi said about the senior high school, I'm very particular about that. Look, the four of us sitting here, there is nobody among the four of us here that needs the money we'll save on free senior high school for any of our wards or dependents we have in senior high school right now, who needs that money more than the finance minister of Ghana right now.
And the other thing too is that not just the senior high school, other social intervention programs, like the LEAP, for example, everybody on that LEAP list needs LEAP. And one thing which also happens is that the LEAP coordinators usually put the names of their relatives on the list, so they get to benefit for free.
That's a general issue with
most
of the policies that we implement. There's certain element of targeting is missing. So it seems to be
that means
a blanket approach that is applied to all. We end up
the wholesale approach is applied to
in a tight hole.
If we means test, we'll get the right people, or roughly the right people targeted. Then they can be the proper beneficiaries of these policies. Government will save money in doing so. But this blanket approach of making, for example, under the NHIS, all persons under 18 years do not pay premiums. You know, no matter who your father or your mother is, once you are under 18 years, the law doesn't allow you to pay premiums. Pregnant women, no matter what your status is, you could be the president of Ghana, you could be the wife of the president of Ghana. Once you are pregnant, you don't pay premiums. The blanket approach doesn't help. Let's means test. I don't know how difficult it is to means test. Government must, like it's done for other areas like the ports, etc., introducing policies to ensure that we save revenue. Let's means test to save revenue. That is a major thing to do, and that wouldn't cost anything.
Let's move to.
No, but quick comment. You know, when the government came into office, they decided to do away with some nuisance taxes.
Yes.
Of course, they also decided to scrap some taxes on some spare parts.
Yeah.
You see, the reality is here now. You see, what kind of analysis was done before those policies were implemented?
Well, the revenue. I remember listening in Parliament. The Finance Committee report stated in all of these, cuts that were done, exactly. It stated the amounts that the country was going to lose.
So about 398 million.
So it's a miracle government thought then that cutting down these taxes, they are not going to get that money.
You're cutting off taxes on real estate sales, which we know is basically for middle, upper middle to upper class people. And now
it was a campaign.
Of course, solve the housing crisis. The taxes on those were
reduced. So we need to get our priorities
right. It was a campaign issue, but that sums up the quagmire that government finds itself in. Let's move on to the health sector now, to Kalibo. But we'll look at this report, which will put in perspective the issues that we'll discuss.
The situation at the Kalibo Surgical Medical Emergency Unit can only be described as dire. Stranded patients and their families or caretakers are seen right from the entrance through to the wards, anxiously awaiting medical attention. Inside the unit, the situation is no different. Patients are being treated on plastic chairs they purchased themselves. Family members of these patients lamented the situation to City News.
There was no bed, so I went out to buy a chair for them. And till date, there's still no bed.
Now, the inside, no space there for the inside, but we have to get bed. We want to sleep on it.
3 days. What's up? 3 days and bring. Then you before say you know he had the same man and Hanomu. The Sahani Pua no I am a fan. The same person who had and we send Jeff now.
Lawrence brought in his sister early this morning for treatment, but the weak sister has had to wait outside hours on ending.
My sister was transferred, from a university hospital. She is having acute kidney, not acute, chronic kidney disease, uncontrolled hypertension, vomiting uncontrollably, having peptic ulcers. And so she was transferred here because of her kidney problems, so that maybe they might dialyze her or something. But she has been on the staircase since she's been here. And just asked the staff, they told me there are no beds. And so I even don't know when we will have the chance of getting into the unit.
For this man, he was forced to spend the night outside. Speaking of camera, his caretaker explained that they are awaiting some lab results due tomorrow before the doctor sees him. Public Relations Officer of the hospital, Mustafa Salifu, tells the news team that the unit has to stop all other incoming patients' transfers to ease the congestion.
We are now contacting other hospitals to ask them to hold on with referrals to allow the place to decongested. So, but if a dire emergency to come, we'll try and then see what we can do. But currently, we want to ask them not to refer all the people. What happens is that we find cases that actually should not come here. They come in and then take up the space. So when you have a dire emergency, then it becomes difficult. So we're asking them, if the case is not too, if it's not too critical, they can call. Sometimes they call and they will offer them telephonic consultation. We give them guides on what to do to help the patient. So once the message goes to them, I'm sure some of them will resort to that so that we can help. They may not come here physically, but we'll still provide the expertise for them to be taken care of.
For City News, Ni Ama Ama.
So that was Ni Ama Ama's report. After that, I caught up with the health minister in Parliament and put the situation to him. If that insert is ready, can we take that now?
They are just about completing their work. Kalibo has submitted input. Ghana Health Service has submitted input. LECMA, they are meeting the CEOs. The committee will soon complete its work. The only good news I want to tell you now, and cut this interview short, is the fact that next week, latest by Friday next week, we will actually commission the expanded new A&E center in Kalibo. We are at the stage where we are quickly trying to procure some new beds to put into Kalibo. But the problem, we will insist, and the technical people are telling me, it's not just the quantity of beds that we have in our facilities, but some aspect of bed management issue, and we are addressing that. I want us to wait until the committee comes up with the plethora of recommendations that will begin to solve some of the numerous challenges that we have within the health sector. You know what they call triaging? When you go into an emergency, they check you and try to see how critical your condition is. So some are flagged red, some are flagged yellow, some are flagged green. If you are not in the red zone, they don't attend to you as an emergency. So you sit there and let them finish with the red ones first. So if you know you are not going to be in the red, right? Why do you go there and put a green there? Then you sit there for 3 hours. Then we have congestion in the A&E. So our conduct too is another problem. But we're going to do public education on some of these things, because it's not only resources that can take away some part of the burden. You see, strategy is another count. I mentioned about 7 satellite polyclinics that were supposed to take off some of the pressure from Kalibo. But some of us are refusing even to go there. At the slight thing, we are in Kalibo. So we are working on that. And I believe within the next 1 week or two, we'll come up with certain things that will show to the Ghanaian population that we are working to try to bring down these type of challenges we have in the facilities.
Rukwaji Mamenu is the health minister. He is the accountant who finds himself at the health ministry and has to balance the debit and the credit for the betterment of our health sector. Let's take some comments now. Joe Hardy Hard says, it was an ill-prepared policy, the free SHS. They can save about 400 million Ghana cedis if they target the beneficiaries. Reality is just biting, the difference between a dream and a goal being played out. Now this one from Hamza Isaku says, super incompetent government indeed. This one from Oseusu says, I love the discussion. Kudos. Keep your comments coming in. Now let's begin with you, Salom. Salom, how did we get here?
As in a Kalibo crisis?
Yes.
Well, it's a difficult question to answer, and it's a big question to answer as well. Kalibo is being Ghana's premier hospital and teaching hospital for that matter for a very long time. And the problems of Kalibo, I think, are one of planning and leadership, and the other being one of policy incoherence. You know, lack of proper planning, lack of proper leadership, and policy incoherence. So, for example, we know that Kalibo is like the #1 referral center in the country. A number of people from everywhere, including the big private hospitals, when people get to critical conditions, they are referred there. What I think we should have done systemically, and it's a problem of systems. Systemically, what we should have done was to strengthen what we call the gatekeeper system. Gatekeeper system is a referral system where, for example, people are filtered. So when you have this condition, you go to the lowest facility first. You go to the next level, you go to the next level. So by the time you get to the tertiary facility, then it means the situation really is an emergency. So you don't run to Kalibo with headaches over a period of time, we've not been able to do that. We've not been able to do that, so the problem is festered. So everybody rushes to Kalibo. And because we've not been able to do that, now it's difficult turning people away. And when you turn them away, where do they go? The other problem too is that the coming of the NHIS has also compounded the problem. Because now you don't really need to have cash to go to hospital. Once you have the card, you go to hospital and usually or generally...
Even with the NHIS, in the course of the week, we had the...
Yeah, I mean,
we had the CEO said that it's virtually...
Yeah, I mean, but it's working. It's doing something. A lot of people now have access to the card, which means they have access to healthcare. So a lot more people throng the health facility. Before, not so many people were going because you must have money. So the NHIS has increased exponentially the number of people who go to hospitals. But our facilities have not grown in equal fashion. So, for example, the Kalibo infrastructure hasn't grown. Other health facilities haven't grown. So the system is about the infrastructure is overburdened. The staff or practitioners haven't been trained enough, or enough of them have been trained to meet the growing pressure, the growing numbers. There is no motivation and a whole lot of things. So it's not just one thing. So, for example, in the UK, they've realized that by 2025, they will need more doctors. So what they have done is that they have increased their annual, intake of medical students from 6,000 to 7,500, so that by 2025 and beyond, they will fill that gap.
And they are looking at increasing spending in the NHS with the money they will get from Brexit.
Exactly. So it doesn't appear that we are doing any of these. So we find ourselves in a situation where we are always firefighting, ad hoc things. So something happens in Kalibo, people are using plastic chairs, or people are being sent away because there are no beds. Then the Ghana Health Service or the health minister, gives a directive: don't turn anybody away. So you give an instruction, but you don't see to it that the other end of it, or where the instruction will impact, has any way of mitigating the difficulties that may arise as a result. So what do we see now? They say we shouldn't turn people away, so the people come, they must be there. So now they don't even have places to sit. Now you have to get your own chair to come there. So we don't plan, we just sit, and the situation festers, and everybody is just talking, and it becomes a talk shop, and then we bring in politics. Okay, when you were there, you didn't do it, and so this is what is happening. It becomes politics, and the matter spoils. That is the reality of Ghana's situation. The matter in Kalibo should be dealt with in an orderly fashion. We should plan. We should ensure that our policies are coherent. When we give an instruction here, we must ensure that where the instruction will impact, is also dealt with, so that by the time the effect of it will reach that point, we have enough systems in place or enough mitigating measures there to deal with it. So basically, that is the issue of our Kalibo.
There's an A&E center opening on Friday, just before I come to
on
Friday.
Yes, I understand it's about 60 to 70 beds, and now we have about 38 beds for the current situation, which will make about 100 beds. The situation, I mean, people have spoken that we need to generally change the design of our hospitals. So, for example, you build a hospital, you know that these are the number of cases you have on the average. Maybe you have more emergency cases than maybe more general cases. So you ensure that when you're designing the facility, you design it such that you have more space for that emergency. But we don't really do that. We hardly even have data. So you just go and then build it in the way that you want without any empirical data to assist you. And so the facilities are very big, but where the need really is, it's not been built to be able to contain or solve the problem. Yeah. So again, it's an issue of planning, and it's an issue of policy incoherence.
Interesting.
Well, I think that in the short run, I think the Salam has hit the crux of the matter with this issue of the gatekeeper system. Look, if you take out all the cases currently in terms of inpatients, that people are admission cases at Kalibo that can be treated in other institutions, or medical institutions in this vicinity, I'm sure you would not have this bed problem you're having here. This bed problem is not a case of bed problem of cases that can only be treated at Kalibo. It's a case of the fact that everybody, as Selon has said, sends people there. I mean, somebody gets a fever and he goes to Kalibo. All right. Meanwhile, there are other facilities in the same vicinity. I mean, within this Greater Accra region, for instance, that could handle some of these cases. All right. And if you go to some of those places now, there are some beds available. I know it is getting tight generally. I remember there was a case in the news recently about somebody who died after being taken to 7 hospitals.
Yeah, 7 hospitals.
You know, it's getting, but the fact is that if you can manage the logistics properly, all right, it would at least reduce the case, the stress on Kalibo, that in the very short term. And as Solomon again said, in the longer term, we need better planning. All right, I really think that.
I mean, all this, the money that goes into consultancy and other things, that when these hospitals are being planned, what kind of thinking goes into?
We don't get the economics of health management right. Is the economics of health management and health delivery that we're not getting right.
You know, the other problem is that we look at health care from just the biomedical side of things. I think we need to also look at the social. We need to look at the preventive aspect of things. So if you're able to strengthen your preventive health systems, you know, the sanitation bit and all these things, you realize the number of people who will go to hospitals will be less, and that will even help you save money. For example, we're in the rainy season. In the next 1 month or two, there'll be cholera. It's been with us, we know.
It's connected.
I mean, the issue about sanitation, that is what leads to cholera. We know that, but we don't solve it. So you realize that in the next month or two, the emergency centers of all our hospitals will be laden with a lot of cholera cases. And so we'll be running around saying that we don't have beds, we don't have spaces. We need to strengthen that preventive health system. We need to strengthen also our primary health care system. If we're able to do these things, spaces in secondary and tertiary facilities like the regional hospitals and the Kalibos of our days, etc., will be reduced. And the pressure that will be reduced, those specialists that will have time to deal with real cases and not be dealing with minor, cases like cholera, which are very preventable. You know, that is one way we can also look at it.
And treatable if they do occur.
Hello, can you tie what you think about this in with the fact that government is opening the UGMC after huge media crusade? This is a war that we led here at City FM and City TV.
That's very good news. I could say kudos to Benadavle and Kuju Okutubuate for leading the crusade in that regard. I mean, the Lopez Syndrome is not with Kalibo alone. It cuts across. Yeah. I mean, when you visit the general hospital, when you go there as we speak right now, you see people lying on bed. I mean, patients are being turned away and things. But the issue is, I mean, where I live close to Ofankor. There's a health facility over there, which is not being utilized. Do you understand? The politics.
The health minister told me that they are still looking for money to do maintenance on that project.
But there's money for other things. There's money for other things. So it speaks to our priorities.
Yeah, exactly. You don't have priorities for things. How can you build an hospital to serve a particular community and abandon the hospital over there? And you say you are not looking for money.
That's even an AFDB facility.
Exactly so. You understand. Rather, when you go to Amasaman General Hospital, the kind of pressure that is on Amasaman General Hospital.
It's pathetic. I've been to the Amasaman place before. You see people lying on the floor, taking drips. I mean, it's pathetic. And you know, it says a lot about us as a people. And you know, the way a society treats its vulnerable, I mean, says a lot about that particular society. When people are sick and they are in that situation, they are vulnerable. They don't look good, and we treat them in that manner. It's very bad, you know. And we can't also stop. We can't also finish talking about this without looking at the attitude of some of our healthcare practitioners. Recently, in Kumasi Central Hospital, also there was a pastor who lost the baby and the wife because the healthcare. I mean, the doctor to perform the surgery on the wife wanted 500 cedis motivation from him. Look at that. This is a health professional trained to save lives.
On that, maybe we need to save some money from all the leakages that are going on.
The things that we are spending money on necessary. Right, we are sitting here right now. This African single, this new free trade zone. Yeah. Look at the way Ghana is hustling to have the secretariat here. Meanwhile, you cannot afford to have beds for your people who are dying.
Well, and you know, let's get our priorities right.
Let's get our priorities right.
There's one other thing too. Given the number of new healthcare facilities we are building, I think Ghana has quite some reputation in terms of how good our healthcare practitioners are. Can't we position Ghana as the healthcare hub in the sub-region, like what India is doing, like what South Korea is doing, like what Singapore is doing, like what Dubai, South Africa and co are doing. With this UGMC, with the NMS facilities, with the Bank of Ghana facilities, with the International Maritime, these are world-class facilities. Yeah. We can put all these together, you know, develop a marketing plan we have to end that here.
Just 2 seconds. Try and scrape money from the system in terms of what is going on in the system. And an office that has been set up to do that is the Office of the Special Prosecutor. And Martin Amidu has some words to say with regards to his office as it was fully institutionalized in the course of the week.
You have to look at the resources you are spending and then the other areas. So we will prosecute serious corruption offenses. The less serious ones, we will maybe agree to reparations and other things. So the public should not be too emotional and just give the office time. And I can assure them that under our watch, nobody is going to interfere with our work. We will be as independent as possible, subject only to the law, the rule of law, and due process. We will treat crime, as I've always said, regardless of party, political consideration, whatever association, ethnic affiliation, crime will be crime. If you go back to my 9-hour vetting, quoted very senior prosecutors and things who have given guidelines as to what we must do. What we are even expecting now is money to start with.
Martin Alamisi Benz Kaiser Amidu, Special Prosecutor of the Republic of Ghana. His office is fully functional now. Hello.
Yeah, so
this will be our closing comments.
Yeah, so you should get started with his work. I don't know the kind of terms or reference that I was giving to him. But if you say, it doesn't have funds, government need to resource that particular office. Otherwise, we trying to set up that particular office is going to be totally useless. The key or the core objective of trying to establish that particular office to investigate corrupt allegation cases will never see day of light. So to me, whatever the funds are, government should give them the funds to work so that at least they can get started with work.
From the experience of Nigeria, if you invest money in this special prosecutor's office, you will get the money back. Okay. Because you catch somebody who's been corrupt, he refunds money. It actually brings in money for the state. So this is one government agency the government needs to spend, knowing fully well that within the space of a year, he will have made his money back plus several times over. So I find it amazing that the activities of the Special Prosecutor's Office should be stored because of lack of financing.
Well, just to state, I was quite disappointed in how long it took the government to put together a board for the Office of the Special Prosecutor. And
especially when it's very clear. The Act sets out
institutional representation. So just ask your minister that, okay, this is what the law or the Act says. Just put these people together. Let's inaugurate, let them start work. And if you recall, not too long ago, he had to complain that he was just in the office. There was nothing happening. He was just left there with a laptop and a driver and a car. There was nothing happening. So fortunately, we have the board in place now. Now he's complaining about money to start the work. How functional is that office? Now with the board, I'm sure his office is going to be giving investigators, prosecutors, and the requisite people who will be required to do their job. It is an important office. We all agree that the Office of the Special Prosecutor is a good one. Let us resource him to do their job. And his collaboration with the Auditor General, I think, is a good thing. Let's help them to recoup or to get back our monies which have gone to wrong hands, for us. Let us not treat this office as just any office so that its establishment will become a white elephant. We don't need that. Yes, we need the office.
Basically, he needs money, so government should give him the money to work.
And if he make the money back.
Yeah, exactly. We're going to get the money back, so government should make the money available.
Thank you very much, Selo Madonu. Thank you, Toma Ami here. Thank you, Elo Deso. To your comments now, Frank Sichope Degbe says, I think we all, including the politicians, are well aware of this country's woes, but we lack the political will to deal with these issues. We are only interested in policies that can help us win elections. We are just thinking about the next election. I weep for this country. This one from Akable says, misplaced priorities, unplanned and spontaneous. Those are your messages, and that's how we draw the curtain down on this week's edition of Press Conference. We'll be right here, same time, 9 p.m. next week on City TV. The program is Press Conference. My name is Duke Mensah Opoku. Good night.